Hey, it's Dr. Vasquez again. I'm here to talk about part two of this three-part segment on breast augmentation. And today I'm going to be talking about the three or four different types of implants that are out there. And it's great to have choices. I love to talk to patients about the different advantages and disadvantages associated with implants and the pros and cons, because everybody really is an individual and has their own goals and their own concerns. So it's great to have choice. So jumping right into it, the first implant, one of the earliest implants that I trained with, is called the saline implant. Still an extremely popular implant today. Even though it has a silicone shell, it's filled with saline. And saline is the same sterile saline that you find in IV bags. So if this were to rupture, your body would absorb it. It would be completely safe. Um, and so popular implants, especially younger people. The next different type of implant is called the silicone memory gel implant. This is made by Mentor, a great company that I support, made in the United States. It's probably one of the most common implants that I place in my patients. And I love silicone implants because they feel extremely natural. Now, I've seen a YouTube video where somebody actually cut these implants in half, and they don't just completely leak like water, but they stay more like a jelly candy or a gummy bear. I've even seen a truck run over an implant and they don't rupture. So a very safe implant, feels very natural, and the most common implant that I place in patients. It moves with you even when you're standing or running, and they become just like your body. The next generation of implants is what the internet calls the gummy bear implant. The gummy bear implant is actually technically called a highly cohesive anatomic shaped implant. And it's anatomic shaped because it has a nice teardrop natural shape to it when you're upright. But even when you're lying down, it still maintains its shape because the gel is very highly cohesive. It has a texturing, so the implant doesn't rotate or go upside down. So another great addition to implants. As you can see, it comes in different profiles and different projections, so we can really tailor the implant based on your own body shape, your own goals. The latest technology to come out there is called the ideal implant, and the ideal implant goes back to basics. It has saline inside this implant, but what you don't see is that this implant has actually several layers inside called baffles, much like a waterbed. So, those annoying waterbeds before they had baffles, you could always feel somebody get out of the bed and your body would rock with it. But with baffles inside a waterbed, you don't feel that, and it maintains a very natural and soft feel, almost like silicone. I'm going to hold up a saline implant side by side so you can see the difference of what happens to the shell, and you can see that in an ideal implant you have much less of the rippling and that fluid wave that you normally feel. And then the other greatest advantage about the ideal implant for people who are really concerned about a silicone leak is that this is filled with saline. So if this were to rupture, your body would absorb it naturally, and you know it right away that it was ruptured and it would be replaced. So another great addition to the line. So as you can see, there's so many different options. There's not a one-size-fits-all. You can really tailor the implant and your concerns with what's going to give you the best outcome. And I love talking to people about that, having them come in and actually feel the different implants, and we make that choice together. So for next part, I'm going to be talking about a little bit about activity, recovery afterwards, and actually a technology that I brought into my office called the Chrysalix, where you can actually do a simulation of what breast implants will look like in you based on the different implants and sizes, and so you have a great understanding of what you're going to look like even before you have surgery. So stay tuned.